To apply the thumb spica splint, you'll first need to determine the correct splint width. Take a thumb circumference with a measuring tape or a Pro-Care elastic bandage. The circumference should approximately match the width of the splint. To confirm the accurate length of the Exos Rapid Splint, use a measuring tape, Pro-Care elastic bandage, or Exos Rapid Splint, and measure from the tip of the patient's thumb to about 2 inches below their elbow crease. Before you apply the Exos Rapid Splint Thumb Spica, it's necessary to heat the splint. First, make sure the splint warmer is completely closed. Then, take the Exos Rapid Splint from its package and remove the foam padding if applicable. Slide the splint into the open end of the splint warmer. Leave about 2 inches of the splint exposed. Attach the hook wand to the exposed end of the splint and slide the splint all the way into the splint warmer. To begin heating the splint, plug in the splint warmer. Allow the splint to heat for about 5 to 7 minutes. After the Exos Rapid Splint is heated, remove the splint from the warmer. Please note, adjustments can be made to the splint prior to heating or post-heating if necessary. Trimmed edges should be rounded. Reapply the foam padding if applicable, and ensure padding extends beyond the edges of the splint. Trim the pad if needed. Place the patient's thumb in a functional position with their wrist in about 30 degrees of extension. Their thumb and index finger should be in opposition. Put a slight longitudinal fold in the splint and drape it from the tip of the thumb to the forearm. Ask the patient to hold the splint in place while you apply the Pro-Care elastic bandage. Start by securing the splint with 2 wraps around the wrist. Continue by making 2 figure-8 wraps around the thumb. Finish by wrapping the splint proximally in order to secure the entire splint. Be sure you mold the splint well around the thumb and distal tip. In every instance, mold the Exos Rapid Splint as prescribed by the patient's physician. Use moderate elastic bandage tension, more than you would with fiberglass or plaster splints, to ensure good molding. Add shape and contour to the Exos Rapid Splint by molding with your palms. This significantly increases the final strength and rigidity of the splint and reduces setup time. If the final position of the splint is not ideal, remove the elastic bandage, place the Exos Rapid Splint back into the warmer, and repeat the application process. If you prefer, you can cut a V in the distal end of the splint over the thumb. This will enable you to easily check the patient's circulation and capillary refill. With standard heating time, overall hands-off rigidity should be achieved in approximately 3 to 5 minutes, while full rigidity will be achieved in about 10 to 15 minutes.